my name's Joanne Caffrey. Welcome to Police Custody Basics, and I just want to cover some basic custody errors which caused today's trial for the defendant to be acquitted in relation to drug driving. So the scenario is we have a person who was charged with driving whilst unfit through drink or drugs, and also failed to provide a specimen at the police station. So let's look at the circumstances and look at the basics of police custody which weren't complied with, and if certain procedures were conducted, then you could have had safeguarded the investigation and also safeguard the detainee. So the initial call for service, it's a road traffic collision, an RTC. So two police officers attend, they find the person, they find the vehicle that's been in the collision. The male admits he was driving. He is then breathalyzed at the roadside and he provides a specimen which is over the limit. But because it's the handheld roadside device, that cannot be admitted as an evidential procedure. So it's an indication, but it's not evidential. So he's arrested on suspicion of driving whilst over the prescribed limit and also suspicion of being unfit. So thinking about mechanism of injury, from a road traffic collision, the car's quite badly damaged. We've also got to think about mechanism of injury, and there's a risk identified that he may have RTC injuries, so such as head injuries like a bleed on the brain, or internal injuries. Now, normal standard procedure, either you get a paramedic to the scene to triage the person, or they get taken to hospital, or upon arrival at custody they get seen by the HCP just to make sure that there's no obvious injuries and risks there. Now, he was taken to a non-designated police station next. So there's a separate video in relation to the issues around non-designated versus designated, but he's taken to the non-designated police station. He is taken straight into the drink drive procedure, so the MGDDA, and whilst he's sat there and they commence the procedure, he goes limp, he appears to be unresponsive, and he collapses to the floor. The officers believe it's genuine. They then call for an ambulance to attend. They also ask for colleagues to bring a defib machine. The police officers say that he was unresponsive to calls from them. He also started turning blue to the lips and the fingers. So those are things that you can't really pretend and make yourself go blue. They said he was unresponsive, floppy and dribbling, and he was making rasping noises, and one officer described it as agonal breathing. So there we've got sufficient suggestions that it's a medical emergency is occurring, and the officers correctly have requested the ambulance to attend the police station to him. So we've also got issues to think about. If we think about the 4 R's, so PACE, Code C, Annex H, in relation to the 4 R's of the rousability and the responding. Because he's failed on multiple aspects of that, then he's failed the 4 R's, he must then receive either the medical attention or be taken to the hospital, and that's a must in relation to that. We've also got descriptions from the officers that he was shown aspects of being intoxicated and incapable because he was unable to be seated without support, he was unable to speak, he was unable to look after himself. Now, the ambulance crew attend, and in the meantime he starts coming in and out of consciousness. He's having some words with the officers, but he's not really making much sense. The officers now fear that he's taken some kind of drug, and they're asking him about what has he taken, has he taken drugs, because they need to know for his well-being. He then says that he's taken a pink pill. Well, a pink pill could be an ibuprofen or it could be something else, but they suspect that he's consumed some level of drug. So again, we've got more risk factors, because any detainee who is suspected of consuming drugs at the very least has to be assessed by the HCP. So the paramedics arrive, they do their basic checks, and there's nothing obvious. But then one of the paramedics speaks to the officer and says, you know, what happens about police protocols? If we're happy with him, are you happy to keep him, etc. So they never said he's fit to detain, which they can't authorise anyway, but they never said he's fit to detain. They never refused to take him to hospital. The officers said, yeah, if he doesn't need to go to hospital, we'll keep him here for the drink drive and then he'll be sorted after that. So the paramedics decide that he doesn't need to urgently go to hospital because he's now back conscious, but he's talking, really doesn't know where he's at. There's aspects there of amnesia. There's certainly elements of risk which are being demonstrated by him. He's asking, you know, where is he? He doesn't know what time of day it is. He's talking a bit of gibberish. The officers try and go through the drink drive procedure again. They get the custody sergeant on the line from the designated station. It's decided they take him to the designated station, so they take him to the designated station. Once they get there, what should have happened, at the very least, is the HCP should have been called to see him because of all these risk factors, to establish he's fit to detain there for the time being, he's fit to undergo the evidential drink drive procedure, that he's got the capability in relation to the functional assessment, that he's capable of making a decision and understanding his rights and entitlements. Or the alternative is he goes to hospital and the hospital procedure occurs so that the specimens can be obtained there, and then at a later date, when he's deemed to be capable of making decisions, he can then make the decision whether or not he's going to give permission for the blood to be sent off for the evidential testing. So the evidence didn't need to be lost. It could have happened. But he gets taken through to the evidential procedure without any fit to detain assessment, so no HCP is involved in this. He then doesn't give consent to give the breath, but he's also rambling and not making an awful lot of sense. So jump forward now to court date time. And the case then on the day before trial commences, it collapses and the CPS withdraw the allegations in relation to the unfit and the fail to provide, because you have to fail to provide without reasonable excuse. So here we've got possibilities that he had a head injury, he'd been starved of oxygen, there were serious medical issues going on. Was he fit to even be in that procedure? The safest option would have been to have taken him to the hospital and do the hospital procedure, or failing that, at the very least, have a full fit to detain assessment with the HCP and establish functional capability and whether or not any reasonable adjustments were required, and then it would have been a safe prosecution. But as it was, because of all these medical risks and these emergency issues being ignored and no fit to detain assessment being conducted, the case was lost. And again, it's emphasising that just because the paramedics attend to someone, they have no authority to conduct a forensic assessment of a person. You've got two medical strands. You've got general forensic medicine and then you've got your clinical medicine. So all of your medical professionals, whether they're civilian paramedics, nurses or HCPs, they all can perform a clinical doctor-patient relationship, which is confidential. But then you've got your forensic medicine. And to conduct the forensic medicine, which includes your fit to detain, your fit to interview, your Road Traffic Act procedures, those have to be performed by a person who is the HCP and who is authorised in order to conduct the forensic process. So your hospital staff and your civilian paramedics, even if they've got a form suggesting fit to detain, they can't conduct a forensic assessment of a police detainee. That is advice that they're given and information to feed into the national decision making model at the likes of the level 1 for the sergeant and the officers, but to weight that accordingly as well. but it doesn't out-trump anything and everything else. It's just information to feed into the NDM. You've still got your risks that are there. So at level 2, you've got your threats and your risks. Then you've got to be looking at what are your powers and policies. So they're the core document that pulls together all the law and all the authorised professional practice is the College of Police and Authorised Professional Practice, which will either mandate directives, so it'll say you must do this, or it'll say things like you should, or it'll give you other options that you may take this into consideration. So then you need to know which advice is a must, and if it's a must, then it's expected to be done unless the officers can justify with use of the NDM that the threats that were balancing and being weighed out-trumped that guidance. You can't just choose not to comply with it. So the main thing from this one today, again, it's another case that's collapsed of a scenario that should have been a straightforward conviction, which because of combining the intoxilizer officer and the custody officer, they must be in sync, and each officer needs to understand what the other's doing. And it was the failures of the custody processes and safeguards that didn't occur, which then caused the case to actually collapse. In the information at the bottom of this video, there will be explanations and links to the certain powers and policies. But if you ever want to discuss anything, then my name's Joanne Caffrey. I provide expert witness services, but I also provide training, and that's whether you're on the prosecution or the defence teams. The facts remain. It's the custody process which we're looking at, and thank you for your time.